Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss few important questions from musculoskeletal system for your CPC exam. So yesterday's video I have discussed all the important prophy procedures which been questioned in 2025 CPC exam. So today I have taken some 5 to 6 questions which are very important. So the first question you can see here. It is about secondary repair of extensor tendon in wrist with free graft. So the question is, patient had a surgery a year ago to repair two extensor tendon in his wrist, and he is in a surgery for a secondary repair for the same two tendons with the free graft. Okay, what CPT coding is reported. So yesterday only I have discussed when you got an procedure regarding tendon, we have to check they are performing a primary procedure or a secondary procedure, and also we have to check whether they are doing extensor procedure or flexor procedure. Okay, in this question they are doing extensor, so you can check the CPT codes and the options. So I'll show the codes. So if you see here, revision, repair, and reconstruction. So here, 2526063, 25265, and 25270 and 72. You can check here. So as you already aware that we are not discussing a procedure called flexor. Okay, so you can ignore these CPT codes, and we are discussing on extensor procedure, and here extensor forearm and wrist, and which is a primary procedure. Okay, we don't need primary procedure. In our question they're talking about the secondary procedure. Okay, so secondary procedure we have to select the secondary repair. Okay, so for the secondary repair your answer should be 252. What is the answer? 25272 secondary single. Okay, so if you see here, secondary a single each tendon or muscle, and also additional code if you see secondary with free graft 25274, that is again for each tendon or muscle. So noting that free graft, okay, free graft, refer the question one more time. So in our question they are also said free graft. Okay, so first coding point is the procedure, which is an extensor procedure, and it is a secondary repair, and then they have also said with the free graft. Okay, so by taking all the keywords your correct answer is 25274. 25274 is the correct answer, and additionally each tendon they said. Okay, each tendon, but in our question they are saying two tendon repair. Okay, two tendons. So what we have to do, we have to give units to 25274 with unit 2. Okay, 25274 with unit 2 is the correct answer. If free graft was not there, then you would have selected 25272. Okay, this one. So now for this particular question our answer is 25274 with units 2. Okay, this is the right answer. So next question, answer C is correct. And next question is, you can see a patient present for primary osteoarthritis in right wrist. Physician performs an injection of 1 mg of Synvisc and in the right wrist joint. What CPT coding is reported? So for this Synvisc, you have to check this orthosynthesis procedure. They are saying the injection is performed on right wrist. Okay, so check the code for right wrist. So what will be the correct answer you will get to know. So just you have to refer between 2060 series and 205 series. If you check, so you can see here 20605 orthosynthesis aspiration or injection on intermediate joint. Okay, intermediate joint include wrist, elbow, or ankle, and furthermore. And also in the question, you have to check ultrasound guidance is being utilized or not. And again, if ultrasound guidance is not being utilized, any other guidance they have taken or not. Okay, these are the points you need to check. So in our question, they are not utilized any kind of image guidance. Okay, and they have did an injection on right wrist. So right wrist belongs to intermediate joint. So for that, you have to select without imaging guidance. 20605 is the correct answer. Okay, and ICD, this you can check. This will come as primary osteoarthritis of right wrist. So this will be the correct one. Next question, incision and drainage of superficial hematoma of the elbow. So what CPT code is used for incision and drainage of superficial hematoma? So superficial hematoma, this is very important because since you are dealing questions from musculoskeletal system, your insights will always tell you like the correct answer is from 2 series. But that is not always, you should not practice that. So here they are questioning incision and drainage of superficial hematoma of the elbow. So you have to refer the coding guideline what we have for IND procedure which belongs to musculoskeletal system. So let's check that. So if you see here in option you have 2 series options as well 1 series options. Okay. So if you refer, so you can see here incision procedure on elbow location. So incision and drainage of upper arm or elbow area, deep abscess or hematoma. Okay, so from musculoskeletal system, what we have for IND procedure, it is for deep, okay, deep abscess or deep hematoma. And if you see the note here, for incision and drainage of procedure, superficial, okay, which is less complicated. For the superficial, you need to see codes in the integumentary section. Okay, you have to take code from the integumentary section. So in our question, they are questioning about superficial hematoma. So you have to check the code from integumentary. So you can just refer between 10160 and 10140. So 10160 is puncture aspiration of abscess hematoma. 10140 is incision and drainage of hematoma. Okay, so we are not doing aspiration here. We are doing incision and drainage procedure. So the correct answer is 10140. Okay, 10140 is the correct answer for this particular question. So next patient with the scoliosis, posterior orthodesis performed on 3 cervical vertebral segment C3 to C4, C4 to C5 and C6. Okay, so here the answer should be I will first should be one interspace we will code, and later additional interspace we will code. Okay.